And then I can just come back up. Oh, here's
Settle down, sister. I've got a nickname for it.
I'd like to call the Finance, Ways and Means Committee to order for March 9th, 2021. Mr. Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gant, Garrett, Gillespie, Hawk, Hicks, Lamar, Lambert, Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chairman Hazelwood. Madam Chairman, you have a quorum.
Thank you, Mr. Clerk. Are there any personal orders or announcements? Chairman Faison, are you?
I just want you to know.
We all know that Chairman Faison is among us. All right, seeing none, we have 7 bills on our calendar today. Following that, we'll be hearing, doing a budget hearing from the Division of TennCare. So we do have a full afternoon and we get started a few minutes late. So we'll try to move as expeditiously as possible. And we're first going to take up the calendar. Item number 1 on our calendar is House Bill 1042, Chairman Kiesling. Chairman Kiesling, you're recognized. We have a motion and a second.
We're running along here with the amendment. Chairman, or Chair Lady, I'm sorry, excuse me.
In the drafting code
And
of that
that, yeah,
amendment,
yes, ma'am, I'm getting it for you. Let's see.
we have
Ooh,
00.
see if this one works, 4393 drafting code.
That's what we have. So
Okay.
we
Thank
have a
you.
motion and a second on the amendment. Would you like to
I'll
describe the amendment,
briefly, yeah, I
please?
can briefly explain the amendment. Last year, we passed, members, a TIF bill, taxes in, a tax increment financing bill for our distressed counties. I'm sorry, I'm out of breath. I just came out. Forgive me. Unfortunately, though, based on the date that we initially passed, the number of distressed counties changed and nullified that bill. So this amendment will allow the bill that passed last year to now be effective. Now, actually, the amendment applies to the same counties, though, as last year's. And anyone that passed a resolution or other official action prior to that magic date of January 1, 21 is eligible. But with that is an explanation of the amendment, Chair Lady.
We have a motion and a second on the amendment. Are there any questions on the amendment? Leader Lambert.
Mr. Chairman, I just want to say you ran a fine committee right before this one. I just wanted to brag on you for whatever length of time I need to so you can catch your breath.
Ooh, wow.
You want a bottle of water or anything? I know you just
I've
came
been-
out of committee.
Yeah, I've been in a gallop all the way up there and back.
I think you had to go back to your office
I
and get your
did.
folder.
Sir, yes,
So
sir.
I'm buying you some time here to just catch your breath. It's a great
Thank you.
presentation, but you good to go?
Well, appreciate it. Yes, sir.
All right. Thank you,
sir.
Madam Chairman.
All right, we
Thank you,
have,
Chair.
the amendment is before us, Amendment 4393. Any questions? Seeing none, all in favor of adding Amendment 4393 to House Bill 1042, please signify by saying aye. Aye. Any opposed? The ayes have it. The amendment 4393 is now with the bill. And Chairman Kiesling, would you like to take a moment to explain the bill as amended?
Yeah, I can wrap it up with this statement. House Bill 1042, now, as introduced and as amended, it revises provisions governing the allocation of sales and use tax revenues to certain commercial development districts. Now, in this case, members, this is regarding Cumberland County. We've got a 33-acre site up there that can be financed with these TIF funding. So it will really be a boost to that area, and with passage of this, that will give them the green light to proceed. So I'll entertain, Chair Lady, I'll entertain any questions then at this point in
All
time.
right, the question has been called on the bill. Are there any objections to calling the question? Seeing none, we're now voting on House Bill 1042 as amended. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 1042 moves on to calendar and rules. Thank you, Chairman Kiesling, and we're sorry to make you have to
Well, that's
run.
fine. And Chair Lady, if I may, if you'd give me permission, I'd just like to acknowledge the effort and assistance by our staff, legal staff, Joel Hayes and Anastasia Campbell. Thank you all very much for your help and assistance. And again, thank you, Chair Lady and members.
Thank you. Item number 2 on our calendar, House Bill 913, has been taken off notice. So we move to item number 3, House Bill 515 by Leader Gant. We have a motion, we have a second. Leader Gant, you're recognized.
Thank you, Chairman. This bill exempts smokeless nicotine products from the tobacco wholesale tax. This bill simply clarifies that any nicotine product that has no tobacco in its composition is not subject to the Tennessee 6.6 OTP tax, which is other tobacco products. And this bill passed obviously last year, if you remember, on the House floor and was not calendared due to the COVID pandemic. So with that, Madam Chair, I turn it back to you for questions.
Is there any discussion on the bill? Questions? Question has been called on the bill. Any objections to the question? Seeing none, we're now voting on House Bill 515. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it,
Thank you, Chairman.
and this bill moves forward to calendar and rules. We're now item number 4 on our calendar, House Bill 367 by Chairman Williams. Chairman Williams, you're recognized.
Thank you, Chairman and members. House Bill 367 clearly defines what the term micro market means as it relates to unmanned facilities for the usually located industrial, commercial facilities where an employee could purchase goods or services from a kiosk that's unmanned there. This bill also goes further to allow for those industries that are micro markets to be able to file one report with the Department of Revenue for all those facilities at those locations in lieu of filing one for each address in which they're located. Madam Chair Lady, we passed this bill last year, and the Senate chose not to move it. And so this is the exact same language from last year. I'm happy to answer any questions you might have.
All right, the bill is before us. It's been properly motioned and seconded. Are there any questions on the bill? As the chairman pointed out, we completed our work on this issue last year, so now we will complete it again, and hopefully this time we'll have companion work that will be done. You're now voting on House Bill 367, moving on to calendar and rules. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 367 moves on to calendar and rules. We're now at item number 5 on our calendar, also by Chairman Williams.
Motion.
We have a motion and a second. Chairman Williams, you're recognized.
Thank you, Chair Lady, members. This bill is the transparency and controls bill for the entertainment tax and exemption tax credit. Currently, the ECD has in the past spent monies and grants towards film and movie industries and miniseries across the state. What this bill, instead of being a first dollar investment, would be a reimbursement of expenditures that these industries do. The fiscal note wouldn't, or the fiscal impact wouldn't be until 2023, because as sales tax revenue is reimbursed for the sales tax, as well as labor costs associated with it, these incentives are capped based upon the half of those labor expenditures, and capped at the duration based upon how long those incentives are applied for. This is an administration bill. I'm happy to answer any questions you might have.
Heard the explanation. I see a question, Representative Miller.
Thank you, Madam Chair Lady. Mr. Chairman, as I read the summary, it creates a sales and use tax exemption
Mhm.
and a franchise and excise tax credit for film productions that would be approved by commissioners of the Department of Revenue as well as the Department of Economic and Community Development. My question is, will these two departments determine what films will be produced in the state of Tennessee under this legislation?
Chairman Williams.
Thank you, Chair Lady. The ECD will still determine which film industry incentives through those departments, much like they do their current grants, except they have, before they can be approved, they have to meet these criteria for sales tax through Department of Revenue and these excise tax credits. The reporting is done in both departments, one annually and one every 4 years based upon those tax credits.
Maybe I didn't explain. that
Representative
well.
Miller.
Thank you, Madam Chair. The question, will the two departments determine before the industry can benefit from these taxes, will they determine what films, for an example, film company want to produce a certain film to qualify?
Chairman Williams.
The commissioners of ECD and Department of Revenue can refuse awarding any tax benefit to these new productions at any time.
Thank you, Madam
Representative
Chair,
Sexton.
for that.
Thank you, Madam Chair.
Oh, I'm sorry. Representative Miller, I thought you were done.
And I'm looking at the estimated impact, foregone state revenue. And I think you said it starts in FY 22-23, which looks at 1.3 million. And in subsequent years for 27-28, it's $15.7 million. Is that correct?
Chairman Williams.
Is the question, is the fiscal note correct?
Yes.
Yes, the fiscal note is correct.
Thank you. Thank you, Madam Chair. Thank you, Mr. Chairman.
Representative Sexton.
Thank you, Madam Chair. Mr. Chairman, I have a couple of issues that bother me about this. One is the fact that we're giving sales tax to an industry, and mom and pops across the state, they don't get anything like that. That's my first problem. I appreciate ECD and the work that they do in trying to bring industry in. But my second problem is a question that I'll ask you. Is this associated with the Hollywood film industry?
Chairman Williams.
Thank you, Chair Lady. The answer to your first question is the nature of this revenue is foregone revenue. The definition of foregone revenue means that if these industries didn't come here, then their sales tax revenue wouldn't be generated, which is why they would receive a tax credit if the Department of Revenue recognized this as a acceptable entity for that reimbursement. As it relates to the term Hollywood, I can't really comment as to what that definition of Hollywood is. If the question is, will there be California-based companies that come here to produce movies or TV series or things of that nature? The answer to that question is possibly, but we don't know who those entities are at this point.
Thank you,
Sexton.
Chairman. First of all, let me say in that first question, as would be with any company that comes here, if they didn't come here, that tax revenue would be foregone. So we don't give every company that comes here a tax incentive, give them their sales tax back. So I don't accept that as, a valid issue. And to the second point, I don't want companies coming here such as the Hollywood film industry that would hold us hostage as they did in Georgia and other places and cause us to be like California. This is Tennessee. We're not like those places, and I don't want to turn into those places. So, as I said, I appreciate the work that EC does, but there ought to be some clause in there that they could not hold us hostage if we did not comply with their radical agendas that they're putting forth all across our nation today. And that's all I have to say.
Chairman Williams.
I appreciate my good friend, representative and pastor. The commissioners of ECD and revenue can refuse to do the tax incentives for any entity at any time. So,
Leader Lamberth.
Chairman, I just want to say thank you for carrying the bill. It is a very conservative approach in a very different way, and you have fought for these type of issues for years to not give companies on the front end taxpayer dollars, but to make them prove that they're actually going to invest in Tennessee and then have some benefit on the back end. And this may help with some of my friends and members that share my dislike for some of the Hollywood values that have tried to be inserted in other states and tried to hold those states hostage. The only group that I have met with that is a big fan of this is the folks that do VeggieTales. So literally, that's the group we met with right afterwards. They reached out because these are smaller grants. These are smaller opportunities. And so it's actually the opposite of Hollywood. It is designed specifically for those folks that do shows like VeggieTales that are not very costly, but it does encourage them to come to Tennessee. And if they actually invest here, it allows folks like that to be able to show Larry the Cucumber and to a whole new generation of folks. And so I only bring that up because I had some of the same concerns when we first saw the bill. And I appreciate you, Chairman, carrying it because, again, very conservative way to help small business owners and specifically small production companies that currently it's all Hollywood and the big guys. So this one helps the little guys. Thanks.
And I might just take a moment of privilege to tack onto that a bit to say that this would give an opportunity for our young people who are interested in the film industry to be able to work in that industry in this state and not have to go to California and some of those more liberal areas to find the kind of work that they're interested in doing. So from that perspective, I think it too lends itself to keeping our kids at home. And Representative Sexton, I believe you had a follow-up.
Yes, and I like VeggieTales too, and also like Mr. Potato Head, but he's dead. And it's a change of culture that we're inviting in. And I appreciate my conservative friends, and they fight for conservative values all the time. We just have a difference of opinion here about what monies are used. And again, let me say, if mom and pop comes here and brings a furniture store or convenience stores, we're not going to give them the sales tax back. And I think it's a double standard when we try to bring in these companies like this and the sports authority and everything else, when these little mom and pops, we've got so many conglomerates today that are taking over. We need our neighborhood stores. We need Mr. Potato Head back. Thank you.
Chairman Crawford.
Thank you, Madam Chair Lady. And I would ask the sponsor of this, a few years ago, when we had the TV show here, Nashville, the series, we were providing some data. And at that time, for every dollar we spent toward this entertainment grants or with ECD and stuff to bring in these things, we were receiving $4 back on our investment. I would be curious to see what that investment is now, if any. Thank you.
Chairman Williams.
thank you, Chairman Crawford. You're exactly right. That was the case. The only difference was then we were funding it with our state appropriated dollars. So we were investing dollars and trying to get a return. What this is, it's a reimbursement of their dollars back to them that they actually invest in our communities, which is really good. I just wanted to the Chair Lady Hazelwood's comments reminded me, one of our institutions of higher learning here in Nashville has a program in which where they do animation. You can receive a degree in animation. Those young men and women in that department have to go outside the state of Tennessee to be able to work. And so, and do animation similar to what Leader Lamberth was just talking about. So not only does this create an incentive, it creates an opportunity for Tennesseans to stay in Tennessee to do these jobs. And so for that, I'm also pretty excited. But thank you, Chair Lady.
Representative Shaw.
Thank you. Thank you, Madam Chair. And let me thank the chairman for the legislation, because from what I understand, we're clearing up some issues that we've been duped on before. And to me, I think this is going to put things in order where we won't suffer some of the issues that are being brought up now. So I want to thank you for bringing legislation. And I personally think it's a good piece of legislation. And I just want to thank you for that.
Leader Gant.
Thank you, Madam Chair. Just to give you an example, Mississippi did this same exact thing. And it actually, if anybody watches HGTV, the show My Hometown was created because of this piece of legislation. And it targets Laurel, Mississippi. And so it puts the target on the state, municipality in that state. And that is the direction of the governor under this administration, is to draw more attention to Tennessee through this piece of legislation like that. So just want to give you that example. Thank you.
Thank you, Leader Gant. Representative Lamar.
Thank you, Chair Lady. I just wanted to say that I really appreciate this bill. As someone with several friends who are filmmakers in the film industry, they're all trying to leave Memphis. They're all trying to leave because there's no incentive. They can't stay here. So I'm so thankful for this legislation for us to bring support for them. So I will be voting in affirmative for this bill, and I appreciate this legislation.
Representative Gillespie.
Thank you, Madam Chair. I just wanted to kind of echo some of my colleagues' statements. There have been so many opportunities in Memphis and Shelby County where there have been films, large and small, that have not taken place, that are based off of people that are from Memphis, live in Memphis, that have been passed over and put in other states. And I don't want to keep seeing that happen. So thank you.
Thank you, Representative Gillespie. Any other questions? Representative Whitson. Chairman Whitson. The question has been called. Any objection? Seeing none, we're now voting on House Bill 141. All those in favor, please signify by saying aye.
Aye.
Any opposed? The ayes have it. If anyone would like their nay vote codified, please see the clerk. Item number 6 on our agenda has been rolled for 2 weeks, and that brings us to item 7.
Thank you, Madam Chair. We're on the last item on our calendar. This is item number 7. It's House Bill 131 by Chair Lady Hazelwood. I believe I've heard a motion and a second. Chair Lady Hazelwood, you are recognized.
Thank you, Mr. Chairman. This bill simply codifies what has been the practice in Tennessee for many years in terms of underground utility and energy companies that construct new pipeline infrastructure in the state. These companies have long treated installation of the pipeline, the contract labor services, as exempt from sales and use tax. They pay the tax on the materials, but these are put in by third-party contractors, and we have never collected sales and use tax on, sales tax on that before. And actually, could provide an impediment to growth and economic development in terms of just getting infrastructure, new infrastructure out for areas for development. So all this bill does is codify the practice that has been maintained in the state, and that is that these services will not be, the installation of these services will not be taxed. So with that, Mr. Chairman, I would stand ready for questions.
Questions have been called. Are there any objections to calling the questions? If not, then we're voting on House Bill 131. All in favor, say aye.
Aye.
Opposed? No. Ayes have it. House Bill 131 moves to calendar and rules.
Thank you, Mr. Chairman. Thank you, committee. That brings us to the end of our calendar for today. And now we're going to move on for our budget presentation from TennCare. I'm going to ask them if they would take their seat at the table. We welcome you here. Hope we haven't kept you waiting too long. And Mr. Commissioner, if you would just introduce yourself, and I would ask if other members of your team, if they speak as part of the presentation or during the Q&A, if they would just identify themselves and their titles before they speak, so folks at home will know who you are. So with that, I would just invite you to proceed with your budget presentation.
Thank you very much, Madam Chairman and members. It's good to be with you all again this afternoon. My name is Stephen Smith. I serve as the director of TennCare, and we have members of our team here. And as you requested, they will introduce themselves as they speak. We have just a few slides to go through. Out of respect for your time, members, we're going to go through these very quickly, and we'll leave plenty of time for questions and comments. I'll also point out that we added an appendix to the slide presentation, so you'll see that, and you may find some of those slides to be informative in terms of the budget. Our mission at TennCare remains consistent, and that is to improve lives through high-quality, cost-effective care. And I hope that this mission is evident as we go throughout the presentation today. We've already spent some time this session talking about this theme of the past, present, and future of TennCare. We are excited and we're optimistic about that future. We're very optimistic about where we are today, but we also know that we have challenges in front of us, and we are making every effort to learn from our past so that we don't repeat some of the same mistakes and that we also build upon our successes. Speaking of that past, TennCare has a long but certainly an imperfect history. Today, we're known as having one of the best managed Medicaid programs in the country, but that wasn't always the case. It wasn't that long ago when double-digit growth trends, when the instability of our health plans, and the lack of proper utilization management, it threatened the very existence of TennCare. In fact, back in 2004, prior to 2004, the TennCare budget was projected to take up every single available revenue dollar, or about 91% of every available new revenue dollar to the state by the year 2008. And so clearly this was not sustainable. And so the executive branch at the time and the legislative branch worked together to make some major reforms in 2004. And often what people look to when they look at those reforms, they often look at the number of people that were removed from the program. But actually there were other reforms that were made that really helped the program to be successful as it is today. In fact, if you look prior to the decade prior to 2004, what you'll see is that the TennCare enrollment grew by about 22%. Over that same time period, TennCare expenses grew by 224%. So what that confirms to us is that there were other equally important, if not more important, reforms that were made at that time. And you can see some of those reforms on the screen. We've proven as a state that curbing the rising cost of healthcare and quality improvements go hand in hand. They're actually dependent upon one another. So controlling cost growth, coordinating care, properly managing utilization means that you can provide more services, more benefits, and you can do that without breaking the state budget. And I believe that our budget is a reflection of that philosophy. So moving into our proposed cost increases questions that you all have. First, as you all are accustomed to seeing every year, we have our medical inflation and utilization increase. So this is our anticipated trend. It's always our largest recurring item each year. And I'll note that this represents a 1.42% growth rate, controlling the rising cost of healthcare, and why it's so important for our state as a whole. And this is where that shows up. It shows up in this medical inflation and utilization. To put this in better perspective, if our trend rate has simply been at the Medicaid state average, over the past decade, we would have spent $2 billion more in our program. And I don't think it's a coincidence to note that that's about the same amount that this state has invested in K through 12 education over that same time. So the cost of TennCare being average, it's substantial and it's real. We don't want to be average at TennCare, and we don't have the luxury of being average. If we rest on our laurels, if we go back, if we loosen the cost controls that we put in place, then the state is impacted. And when the state is impacted, considering TennCare makes up such a large portion of the budget, it's inevitable that that will result in cuts to the TennCare program. And that is something that we work very hard to try to avoid. I want to point out a couple of really important maternal health initiatives. And you may recall these from last year. They were actually funded and approved. And then when the pandemic hit, we had to take those out. The first is a dental pregnancy program. This will extend dental coverage to pregnant women 21 and over. We know from research that the oral health in children, and specifically early childhood cavities, that is directly related to bacteria that's transmitted from the mother to the child. And treating those conditions today often requires those individuals to go to the emergency room where they receive anesthesia. And of course, that results in increased risk. And so we actually believe that this coverage will make a big difference in terms of the quality and will ultimately result in some cost decreases. The second would extend postpartum coverage for TennCare members from 60 days to 12 months. We know that maternal mortality is an issue nationwide. It's an issue in this state. The late postpartum period remains critically important. It's a vulnerable period for both the mother and the child. This initiative is about, it's as much about the health of the child as it is the mother. We want to set that child up for success. You heard the governor at his State of the State address talk about the TennCare coverage for adopted youth, which we believe will be an important tool in removing financial obstacles for adopting parents. Presently, we have a number of DCS children and adoptions where the children do not qualify for adoption assistance. And this can create a coverage gap, and it results in a scenario where the child has to rely on the adopting parent's insurance. And that could make the adoption process more difficult. So this is an attempt to remove one of the barriers that may exist, and we think it will have a really positive impact. Moving on to the reductions, I'll highlight just a couple of points. First, we're proud once again at TennCare to be a major player in the necessary reductions in the overall state budget. This year, or for FY22, TennCare represents 57% of the total general fund reductions in the budget. And then second, we've been able to propose these reductions with minimal impact to our TennCare members. For example, you'll see the pretty large reduction in our pharmacy trend. That is a reflection of our actual expenditures over the last few years. Trends have moderated substantially. We were also just doing a better job of managing that program. Our rebate collections have stabilized. And so this is a large reduction that we can put forward that will have no impact on our members and no impact on our providers. The FMAP rate change, that's our federal matching percentage. This year, that works to our advantage. This is strictly a federal calculation that is based on our relative position to other states. And for the second year in a row, it works to our advantage. What that means is we're going to get a higher matching percentage than we had the previous year. The 90-day refill item, this makes permanent a policy that has been put in place since the pandemic started. This will allow providers the option to write 90-day scripts for our TennCare members for maintenance medications. So that means, of course, that it will decrease the number of trips that the TennCare members have to make to the pharmacy. It also improves drug adherence, which, of course, is a really good thing. And then I'll wrap up by speaking to the 340B item. The 340B program, it's a federal program. It's extremely complex. It's gotten a lot of attention at the federal level here recently. We know from our OIG auditors that HHS at the federal level, they're taking a really close look at the 340B program and state Medicaid programs and how that's implemented. But at its core, this item is about making sure that TennCare as a taxpayer-funded insurance entity is not paying more for 340B drugs than we should be. And we try to accomplish that in two ways. One, by making sure that we are collecting all the rebates for which we are eligible to receive under the Medicaid rebate program. And that is a requirement under federal law. And the second piece of this is making sure that we are not paying higher than the 340B ceiling price that has been negotiated on these drugs at the federal level. And the point of that is if we are paying higher than the 340B ceiling price, then what that is doing, it's effectively negating the benefit of the Medicaid rebate program. And again, this gets really complex. I'm happy to answer more questions about that. But I will stop there. And then just one more slide, Madam Chairman. Revisiting FY21, TennCare did play a large role in the overall vacancy reductions that were included by the General Assembly in the budget. And so you'll see on the screen there that resulted in 34 positions for TennCare. So that completes my prepared remarks. I know that was quick, but happy to answer any questions that you all have. And thank you again for the opportunity.
Thank you, and thank you for going quickly through that. I know that we will have questions that will take us down further into the details. And first on my list is Chairman Hawk.
Thank you, Madam Chair, and Director Smith and your whole team. Thank you so much. And I've heard bits and pieces of this previously and really appreciate the work that you do. It is a daunting task when you look at the substantial portion of the budget that TennCare makes up. And I appreciate all the time and effort. And as we've had the conversations before, I have expressed concerns previously about provider rates, provider care, and there's a healthy tension that occurs between our entity and providers that I feel is good. And as we've mentioned several times in terms of legislation and in policy and budgets, sometimes the best policy is an issue that no one is ecstatic about, but everybody can live with. And that's where the tensions are coming from providers as well as entities of TennCare. So I appreciate you listening to me over the years. Madam Chair, if I could, a couple of questions. And Director Smith talked about the FMAP, the Federal Medicaid Assistance percentages. And as we're looking at the $37 million reduction in state investments, is that related to COVID or how is that related, or is it just an organic situation that's occurred for our state?
Thank you for the question. So that item is actually not related to COVID. So this is something that happens every single year where the federal government sets our matching percentage. And again, it's just based on, I don't know, William likes to say they go into a dark room and they do the calculator and they figure it out, and then they just tell us what it is. Some years it works to our advantage and some years it doesn't. For the second year in a row, it's working to our advantage, which is kind of surprising. But we'll take it.
Chairman Hawk.
Thank you, Madam Chair. Appreciate it. And you did as well address the 340B program and the reductions therein. I just want to get some assurances, and I know what your answer will be, but I just want to make sure that as we're looking to have some alterations and potential cuts to the 340B reimbursement plan, I want to ensure that patients are still receiving the medications that they need. I know what the answers will be, but I just want to have that conversation with you as we talk about this program.
Yes, absolutely. So we will continue to provide the medications. Of course, we're responsible for the TennCare membership, and by law, we have to provide those medications, those medically necessary medications, and we will continue to do that.
Okay, thank you. Thank you, Madam Chair.
Representative Garrett.
Thank you, Madam Chair. Good afternoon. Thank you all for being here today. My question centers around fraud, waste, and abuse. I noticed in y'all's budget that $1.7 million in reductions from savings that were related to limiting overutilization and reducing fraud, waste, and abuse. And I was curious, how do you track and measure the amount of fraud, waste, and abuse, and then what policies did you implement to generate these savings?
Yeah, thank you for the question. I'm going to defer this one to William Aaron, as our Chief Operating Officer.
Madam Chair, members of the committee, my name is William Aaron. I have the privilege of serving as the Chief Operating Officer for the Division of TennCare. It's good to be with you today. So happy to talk about fraud, waste, and abuse. We have, as a state, a very good infrastructure to address and investigate and identify and root out, right, fraud, waste, and abuse. Our part of that, we don't own all of it, right? Elsewhere in the Department of Finance Administration, there's the Office of the Inspector General, right? That focuses on individual members and their, potential fraud, waste, and abuse in the program. Our focus is on providers, right? And so we have actually two teams that work together in our organization. One that basically just looks at the data, and the other that actually goes in and does the heavy lifting and does the work to put the evidence together. Those two work very closely together to identify items where, again, we've got significant potential for fraud, waste, and abuse. And in a program of our size and our complexity, it's a challenge. But we're very proud of our track record. Every year, really just about every year, we bring an item like this. I'll tell you, for example, here included in this item, this isn't all of it, right? But certainly the kinds of things that we're talking about. We're seeing for orthotics that there are patterns of overpayments, right? So we're moving to actually look at invoice costs and actually pay invoice costs so that we're not overpaying for orthotics. Kind of a similar issue around breast pumps, right? We want to make sure that what we're paying is fair and appropriate, but not inappropriate. And where we see instances of that, we can identify that, deal with those controls, and remove that cost from our budget on a recurring basis. In past years, we've had similar examinations that have looked at, for example, if you walk into a Walgreens or any drugstore, not pushing Walgreens, right? You can find what's called a TENS unit. Some of you may have used them. They just little electrical stimulant pads. You can buy them over the counter. We were paying multiples of that cost through TennCare and put a policy in place that was not what we wanted to do, right? That wasn't appropriate, given the fact that it's widely available on the market for the identical product. So it's something that, we pursue. I mean, we're doing every day of the year that we're working, looking at fraud, waste, and abuse and identifying that, and are very pleased to be able to bring an item like this.
Chairman Whitson.
Thank you, Madam Chairman. And Director Smith, good seeing you and your team, and one of my favorite constituents out there, Ms. Gillingsworth, and Mr. Aaron, good seeing you. And I just want to, first of all, I want to compliment you and your team for being proactive on making sure the Katie Beckett waiver was ready to hit the ground running when approved by the federal government. Y'all did a great job, you and your entire team. And I just really want to tell you how much that is meant to so many families across Tennessee. Y'all hit a home run on that one, okay? And but my question, it has to do with ECF choices. In this year's budget, $11 million to enable TennCare to enroll additional 300 individuals into the ECF Choices program. But last year, and it didn't get, it was requested, but I don't think it was funded, or it was not funded. It was $35 million for 100 slots for those individuals in the greater levels of need, groups 7 and 8, and 200 slots for people on the waiting list. And I have 3 questions. The first one, Mr. Director, is how many people in groups 7 and 8 are currently being served in this program?
I'm going to defer that question to Patty Killingsworth.
My constituent, that's fine.
I do think the crisis slots though last year, those did stay in the budget, didn't they? Yeah. So the crisis slots that you mentioned in last year's budget, we were able to keep those. So we did, those were funded, and then every year we have additional slots where these individuals are deemed in crisis, and we bring them on. But Patty can speak more to that specifically.
Thank you, Representative Whitson. Patty Killingsworth, I'm the Chief of Long-Term Services and Supports, and it's good to see you, and I appreciate the question. Groups 7 and 8, which you referred to, and I'm sure you know this, but just for the benefit of folks who may not, are groups that are targeted to serve people who have intellectual and developmental disabilities and very significant or complex behavioral health needs. So there is a Group 7, which is for children who live at home with their families who have really complex co-occurring needs, and then Group 8, which is for adults typically transitioning out of institutional settings where they've had very intensive services and supports, and it is a transitional benefit to get them ready to live in community. Those groups currently can serve up to 50 people each. I believe Group 8 is almost full. I think it has around 45 people. Group 7 is maybe around 35 people. So not a lot of people, but we intended that the populations in those groups would be really small. This is really targeting a very small subset of the population that has really challenging needs.
Thank you. What would the remaining wait list look like if this $11 million increase that is funded, and what is the remaining need for this?
I think, Representative, you may be referring, so I think we're talking about maybe two different groups. We've got these crisis lots, but then last year in the budget, we also were very excited because we have a waiting list of about 4,000 individuals that are awaiting services, and we were able to initially fund about 2,000 of that waiting list. And then when the pandemic hit, of course, we had to shift. I think maybe that's the population you're talking about. But presently, we still have about 4,000 individuals on that waiting list.
And has the Katie Beckett program enrollment impacted any of these categories? Or
It's a great question, Representative Whitson. We did send letters to any children under age 18 who didn't have Medicaid, who were on the waiting list for employment and community first choices. So there were some of those children who were actually able to enroll in the Katie Beckett program. That waiting list has gone down a little bit as a result of that program opening up. Many of the people on the waiting list are actually adults, though.
Thank you very much, Madam Chairman.
And just to follow up to that, we have this, fairly enormous waiting list. What kind of funding would it require to move those people from waiting list to funding? And is it even possible to do in just in light of the resources and the people that would have to be added?
Yeah, thank you for the question. So I'm trying to think back to last year when we funded half of the 2,000 slots, and I think that was that 70, 90? Do you have that, Patty?
Sorry. This is from 2020 data. I can get you a little bit more current data, but basically to serve the roughly 4,000 people that are left, it's going to be in the neighborhood of $220 million total, right? So that's state and federal combined.
And how much of that would be state?
About 35%.
Okay.
In the neighborhood of 75 million.
We'll do the math, and that would be recurring expense. Okay.
Correct.
So it's a significant hill to climb. I just want to make that point, but we do have 4,000 Tennesseans who are both in need of the services and qualified for the services that we are not currently serving. So, all right, next on the list, Representative Lamar.
Thank you, Chair Lady. This new budget includes $6.5 million to extend the amount of time new mothers are eligible for coverage from 60 days to 12 months. But this is non-reoccurring and is being presented as a pilot program. What metrics would you use to determine if the pilot is successful? And if so, do you anticipate requesting that this is reoccurring funds for the program?
Yeah. So I'll just start out, and then I'll turn it over to Dr. Wu, who can speak about the medical evidence related to this. I would say, we're very confident that this is. we think that there is a need. We're looking initially at what, but I'll turn this over to Victor and he can speak more to this.
Hello, everyone. My name is Victor Wu. I'm the Chief Medical Officer at TennCare. Thanks so much for the question. This is certainly something we are really passionate about at TennCare, given the fact that we serve nearly 50% of all pregnant mothers in the state. We know we have a really outsized role in making sure that our moms have good health care and have good access to health care, and they have good health outcomes. So in terms of evaluation, we certainly believe strongly that this would be beneficial to the mom and to the infant. We know that infants where their mothers have health insurance oftentimes end up coming in for their well child visits or screening more frequently. And so we definitely think that we'd look at outcomes for both the mom and the baby. Some of those outcomes are exactly what I just said. On the baby side, we want to see, are they coming for screening? Are we detecting potential issues for them earlier? Are they getting their vaccinations? Are they getting their well child visits? And for the mother's side, we want to look at continuous coverage. We want to look to see if they're following up for their postpartum visit. We want to look to see if they're getting screened for depression. A lot of the services we know that some of our vulnerable mothers can experience in the year after delivery.
Thank you, Chair Lady. As you know, doulas have been proven to reduce the number of deaths for mothers and infants. Are you considering using some of this money to cover doula services to reduce the rates of maternal infant mortality rates?
Representative, that would not be part of this funding. So presently, we do not cover doulas within the TennCare program. So that would be a separate discussion. It would not be part of the dollars that are associated here.
Thank you, Chair Ladies. Could these dollars, is the language vague enough that if you wanted to, could you?
Let me turn this over to Victor. I mean, I think the answer would be that first we would have to choose as a TennCare entity to cover that service. And then if we did, potentially that could be covered as part of this 12 months. But Victor, do you want to add anything to that?
Yeah, thanks for that. We certainly have been tracking and looking at the research around doulas for our programs. All of our health plans are always interested in finding opportunities to help support our mothers. And several of our MCOs have started to partner with community health worker organizations and those types of opportunities. So I think at this time, the dollars and the way that the bill is written, we know there will be healthcare services first and foremost that we must meet. We need to make sure that our mothers who are screened for depression can go see a mental health provider. We know that our mothers who choose contraception afterwards need to go get access to the contraception. That's what they decide after they have a pregnancy. So our first priority is, of course, to serve and make sure that the medical needs of the mothers met in the postpartum period. And as we continue to evaluate other potentially promising opportunities like doulas in the future.
Closing question, and I'm done. Last question. So if you did or interested in covering doulas, could there be a decision made within your own department, or we need to pass legislation to allow you to do that?
Well, we would have the ability to add that service. If we did add it, of course, there would be a cost to that, and that would have to be part of the budget.
One other thing I'll add to that, just kind of as the opportunities and the roles of doulas are still being kind of evolving in the community, there are federal regulations around what a provider, a Medicaid provider, can be enrolled in the program. They have to be screened, they have to be licensed, they have to have certain, meet certain federal requirements. Right now, as you know, probably better than anyone, that doula is in a licensed category of provider in the state. And so there would have to be some operational and licensure hurdles first to pass as well before the state could recognize them as a provider category for us to pay for directly through the Medicaid funds.
Chairman Williams, I believe you had a follow-up question related to Representative Lamar's earlier line of questioning.
Yes, thank you, Chair Lady. Commissioner, I just wanted to say, I think it goes without saying, but I feel like it's necessary to say it here today. I just want to thank the governor and administration for spending this $6.5 million. I know it was in the budget last year for us to do, and because of COVID, we weren't able to do it. Our maternal mortality rate in the state is one that we don't like to talk about it because it's not that good. And so I'm hopeful that not only this 5-year pilot will improve outcomes for mothers across the state. I think it's really important for us to do that. We all want to care for our mothers. None of us would be here without them. So anyways, we appreciate the hard work that you're doing here. I would ask you though, as a follow-up though, I know that this is not new across the states. I know a couple of states have also implemented these extensions of postpartum or services. And I guess the question for me is if you guys could give us any direction as to what other states are doing and how those changes have impacted their states. I think it would be good for us to use as a barometer going forward. But I just wanted to thank you guys and the governor for what you're doing here. This is in the whole scheme of 40 some odd billion dollars, 6.5. This is probably one of the most important places we're going to spend some money this year. And so I just want to say that and congratulate you and thank you for your hard work there.
Thank you.
Representative Ogles.
Thank you, Madam Chair. Thank you, Commissioner, for being here today. FY 21-22, the projected enrollment for Access Tennessee is projected at about 88 enrollees, and that's been closed for new enrollees for several years. As that number continues to decline, what happens to the savings from that? Thank you.
Yeah, that's a great question. I'll have William jump in here if I say anything incorrect. But the way that program works currently is those dollars have to remain in the Access TN program, and so it would require legislation to do something different with those dollars. You may recall that early on when the pandemic hit, we actually submitted a waiver to CMS to be able to utilize state dollars and get federal matching dollars to serve the uninsured population for treatment and testing and treatment for COVID. And we were going to use available dollars that were in the Access TN program for that purpose. Ultimately, CMS did not approve that waiver request, and they set up another means by which uninsured individuals could receive that testing and treatment. And so we didn't need it. But the direct answer to your question is those dollars remain in the Access TN program, and that's by law.
Right. Yeah, and Representative, I'll just add quickly, Access TN gets funded differently than the rest of the program, right? Because a few years ago, in response to a request, a need to trim the demands on the general fund, right? We submitted a budget reduction that would stop funding Access TN using general fund dollars and would instead fund it from the reserve, right? As you've noted, the enrollment has been dropping over time, and we were able to determine that given the size of the reserve, we could sustainably just take dollars from the reserve each year and fund the program that way. So it's, I understand the question about savings, but this one is funded a little differently, right? And so it's just a matter of spending less from that fund every year as enrollment declines over time.
Leader Lamberth.
Thank you, Madam Chairman. I know I've seen some recent news articles insinuating that somehow or another the shared savings plan that we passed and approved the first week of the session had issues somewhere in the federal government. It was my understanding that that TennCare 3 is still alive and well. We're still operating under that, and that we're still in open and good faith negotiations with our federal counterparts to make sure those shared savings are utilized for Tennesseans. How is that? Where does that stand? And just so we can get an accurate answer, it said it's just been a couple of news reports out there that have been, it appeared to me a little misleading. So what's the truth of the matter?
I really appreciate the question. There has been some confusion on this. I think you said it well. TennCare 3, the shared savings plan, it is alive and well. So we are in implementation. As I said when we discussed this back in January, there's really nothing that we had to do from a day-to-day perspective to get going on this. So once it was approved, we're a go. And there's nothing that's happened at the federal level that has changed that in any way. There's been a lot of misinformation about this letter that came from the new administration that's related to 1115 waivers, which we have an 1115 waiver, but it has no impact on TennCare 3 or our shared savings plan.
Representative Sparks.
Thank you. Yesterday, we were talking about the opioid crisis, and just want to ask about the NAS, neonatal abstinence syndrome, and what you're seeing, how that's trending, and also what's the average cost of when this occurs?
Yeah, I'll have Victor jump in here, but I will say that we've in Tennessee related to our NAS births, we are, in fact, we're the only state in the country that's continuing to report a decline in NAS births. So we're really proud of that. Victor, I'll let you provide some more detail there.
Thanks for the question. Something that I think the state has taken very seriously ever since in across multiple seasons in partnership with this body, as well as, starting the Tennessee Together legislation. We've seen finally some really positive trends. We've seen, as Director Smith mentioned, decreases in our neonatal abstinence syndrome babies, NAS. For those of you who may not be familiar, those are children who have been exposed to opioids during the pregnancy and are exhibiting signs of withdrawal when they're born. And we've seen tremendous decreases over the last 3 years. TennCare hasn't in this place as well an outsized role. We cover nearly 95% of all the births that end up being born, babies being born with NAS after they're delivered. And so we know we have a really important role to play. I do think the pandemic is something that we are watching very closely. We've started to see the opioid overdose numbers start to flatline and actually increase in the last year. And diseases of isolation, diseases of despair, as people call them, have really been exacerbated as part of the pandemic. And so we know that this coming year, there may be some kind of flattening of that curve, or hopefully we're not going to see an increase. But I think that is a reality of what happens when our state is going through such a public health crisis. And so we're keeping a close eye. We continue all the efforts we've done around increasing access to treatment, to evidence-based medication-assisted therapy. We make sure that our women get outreach early on to get the supports that they need to see their primary care providers. And we're really proud of the work that we've done, but the race is not over yet. We're still doing as much as we can.
Thank you.
Representative William is telling me that the cost for NAS births is 3.5 times the typical birth. So it's substantial.
Okay, thank you.
Representative Lynn.
Thank you, Madam Chairman. Hello, Director. How are you?
Hi.
I wanted to ask you, question 2, federal funding sources on the questions that we sent you. I was just curious. It says here that we budgeted $182 million for 1920, and then in 20, I guess we received $113 million. That's quite a difference, and I was just wondering why the difference. I know we pull these questions out, but I was just wondering why there was such a lesser amount spent.
Yeah, it's a good question. I'm going to turn to our numbers expert to give us
Okay.
the answer.
Thank you.
Yeah, Representatives, good to see you.
Thank you.
So the part of what is going on there is changes in the federal match rate. As one of the provisions of the Affordable Care Act, which seems like a long time ago now, right back in 2013. It changed and enhanced the rate, and then that got extended. And so that has moved those numbers around in terms of what we've anticipated. Part of it also is just that as we have, brought re-verification back in to ensure that we're meeting federal requirements in both Medicaid and CHIP, and only those people who are supposed to be on the program are on the program, we have been actually spending less in some areas. So it's a combination of those two.
Leader Camper.
Thank you, Madam Chair. Thank you, Commissioner. Question about TennCare doing the COVID-19 response this last year. Were we able to adapt our services, telehealth, telemedicine, and how well did we perform, from our staff maybe going to alternative workstations? And could you just kind of tell us a little bit about, how TennCare was able to adapt to the changes during COVID-19?
Sure, but thank you for the question. I don't think it would come as a surprise to anyone to know that we've really focused on our response to the pandemic over the last year. It's been such a big part of the work that we've done. So part of that it relates to flexibilities that we have provided. Telehealth is a really good example there. We expanded almost all of our professional services via telehealth so that members could receive that care via telehealth in their homes. We also provided some financial relief to our providers, both through accelerated payments to hospitals and nursing homes. Also, we had some targeted relief in the form of direct provider payments to providers that were heavily Medicaid dependent. So early on in the pandemic, there were a lot of federal dollars that were coming down through the CARES Act But early on, that was based on Medicare. And so you had a lot of Medicaid dependent providers that were receiving very little, if anything.
Mhm.
And so some of those would be home and community-based services, mental and behavioral health, dental, and then primary care. So we were able to infuse about $40 million to those providers, which provided a real lifeline for them. And then you may be interested in this slide. It's in your appendix, but this shows the utilization. We know that utilization was down, especially when the pandemic hit. And so what you see on the screen there, it's comparing 2 points in time, 2020 versus 2019. And so the first column there, you see what happened initially when the pandemic hit, and you see some pretty sharp decreases in utilization. And then in the later months, you see the progress that has been made. And that's due to some pretty significant efforts on the part of our managed care organizations and our providers to coordinate care for our members. And the one that I'll point to is the pediatric well child visits. We actually see we're 2 percentage points ahead of where we were in 2019, even with the pandemic. So that kind of speaks to the work that we have tried to do collectively to ensure that our members are getting the care that they need.
Thank you for that. I guess that was going to be my question about whether the participants were utilizing the services more, but I think this answers that question. So thank you, Mr. Commissioner and Madam Chair.
Thank you, Leader Camper. Director, we have had a number of questions, and I've just started getting those today from some. I have a safety net hospital that serves my region. There are a number of rural hospitals in the state, and there's some changes. You alluded to them in your overview in the 340B program, and I'm very concerned about what that might do to these hospitals. So there's, as I said, there are a number of questions, and we might talk about a couple of them today as we begin to hear more from our friends in our providers and how this impact is, because they seem to think they're looking at a significant shortfall. We may want to have a deeper dive in our appropriations subcommittee or at some other point. But the language in the budget for the 340B program says that there's a reduction in the program's expenditures, and it states that the changes being made to recognize savings and ensure federal compliance. You mentioned that the feds have maybe changed some of the rules, or we're looking at things a bit differently with this 340B drug program. So can you help us understand what these savings are, and then the changes that you're looking at making that perhaps may adversely affect our hospitals? Which ones are required by the federal changes, and which are those that TennCare is just choosing to make, in your view, is the best interest for the state? Well, we may have a different viewpoint on that, but if you could just share that with us.
Sure, glad to do that. Appreciate the question. And 340B is it is very complex, and I've spent an inordinate amount of time trying to learn about 340B over the past several months. So the savings are they come in 2 buckets. So the first bucket is that it results from rebates that we are able to collect through the Medicaid rebate program. So under federal law, we are required to receive all the rebates and to submit all the rebates for which we are eligible under that rebate program. The challenge that we've had is we have been unable to collect the information to know when a 340B entity has been supplying a 340B drug to a Medicaid member. And because there's a prohibition on duplicate discounts, what that means is we haven't been able to submit rebates for any 340B or any drugs provided to Medicaid members from a 340B entity. So What we're proposing to do here is, one, we're just going to collect the information from the providers so that they will have to document to us when they are providing a 340B drug to a Medicaid member. What that will allow us to do is, if it's not a 340B drug, then it's easy. We just collect the rebate and there's no impact on the provider, no financial impact on the provider. If it is a 340B drug, what we're proposing to do is to pay no higher than the ceiling price for that drug that's been negotiated at the federal level. And the reason that we wanted to do that is because if we're paying higher than the 340B ceiling price, then we are not getting a discount because we can't collect the rebate under the Medicaid rebate program. So it's negating the very benefit that we are supposed to achieve through the Medicaid rebate program. And also just, thinking about it philosophically, we are a state taxpayer funded insurance entity. And for us to pay higher than a price that's been negotiated by another taxpayer funded government entity, it just seems counterintuitive. So I don't think there was ever any intent, or at least from what we can tell, there was never any intent when Congress created the 340B program to negate the benefit of the Medicaid rebate program, because both of those programs are supposed to represent the manufacturer's best price, the pharmaceutical company's best price for the drug. I know that gets really complicated. To your question about what is required, what's required federally and what is not. So it is required that we collect all the rebates. So at a minimum, we've got to collect the information so that we can collect the rebates if it's not a 340B drug. The other piece is more complicated for the ceiling price. So at the federal level, fee-for-service Medicaid programs are prohibited from paying higher than the ceiling price. That's not the case yet for managed care programs. We are a managed care program. So it's not a federal requirement for us yet that we pay no higher than the ceiling price for the 340B drug. We just think it's the right policy, because if we do pay higher, then we are not getting the discount as the Medicaid program.
And I won't pretend to say that I understand all that, but I do think I hear you saying that these rules don't currently apply to us because it's a managed care environment. And I also hear what you're saying about, we want to be good stewards and we want to get the best prices that we can. And that's great in theory. I think my concern is the practical implementation, because a lot of our rural hospitals, I think, are depending on these 340B dollars that they have been collecting, and then they've been using that to provide services for the folks who come into them that don't, are indigent, do not have insurance, don't have a means of payment. So if we take away that mechanism, it's going to be a big hole for a safety net hospital like the one in my region, but in a big number. It's not going to be such a big number for some of these rural hospitals, but it is going to be a big part of their budget. And, they're already under stress in many ways. A lot of those rural hospitals are keeping their doors open just almost on a day-to-day basis. So I would, it's raining money, as we all know, from the federal government at this time. And I would just think maybe it might be a time for us to, before we take this action, we might step back and take a look at what the impact is going to be, the full impact on our hospitals and our providers across the state. So just throwing it out there, we can certainly have further conversation about that. And I know, I think the providers are just finding out about this and are just in the process of trying to really see how it's going to impact. But if the impact is going to be as negative as it appears to be on the front end, then I think that we may have an issue that we'll have to deal with in one way or the other. These patients still have to be served. We are required to do that. So it's pay here or pay there, pay now or pay later, but the state is going to pay. And I think we just maybe need to have some more conversation about the best way to do that. But again, that's something that we can dig down into a little bit further. I don't have any other questions on my list. I'm so glad that Chairman Faison woke up, even if he didn't realize that. At any rate, we thank you for being here, and I want to recognize again, as a number of my colleagues had mentioned, TennCare does. I think we can be proud as Tennesseans of the work that your department does, but for all of us, we can always do more and do better, and so that's all that we are concerned about doing, because we still have, unfortunately, we still have citizens in the state who need services that we're not able to provide. So we're just trying to get there and get them those services. But thank you for all that you do. And with that, we're back in session, and we will stand adjourned. They never went out of session, but that's okay. All right.